Welcome to tonight's webinar. My name is Melanie McKinney, Programs Coordinator for Can Do Multiple Sclerosis. Thank you for acting on the belief that you are more than your MS by attending tonight's webinar, Cognitive Changes, with Dr. Deborah Miller, Licensed Independent Social Worker, and Janet DeClark, Speech Pathologist. I'd like to talk a little bit about Can Do Multiple Sclerosis before we start the presentation. Can Do MS is an innovative provider of lifestyle empowerment programs for people living with MS and their support partners. We are the start of a whole new way of thinking about and living with MS. Can Do MS empowers people to move beyond their MS by giving them the knowledge, skills, tools, and confidence to adopt healthy lifestyle behaviors, also to actively co-manage their disease and live their best lives. In 2010, Can Do MS launched its website, www.mscando.org. Please visit our website where you can register for upcoming webinars and also view our archived webinars. Check out our Can Do MS lifestyle empowerment programs, including our Can Day 4-day programs and our Jumpstart 1-day programs. You can also share your Can Do promise and learn ways you can contribute to or get involved with Can Do MS. And a few housekeeping items before we get started. Our presenters will address questions and comments at the end of the presentation, and we encourage questions and comments throughout as well. And you can post your questions by typing in the chat feature located on the left of your computer screen. To submit a question, type in the small box that says Chat with Presenters. This presentation is being recorded, and it will be archived on Can Do MS's website. You are more than welcome to view the presentation again, and if you've missed one of our other webinars, you can find the archived version as well. And those of you who are attending live tonight will also receive an email with copies of the PowerPoint presentation for this webinar. And you can listen to the live webinar through your computer speakers rather than having to call in. So the job of the live participants tonight is to 1, submit your questions and comments in the chat box, and 2, please complete the evaluation at the end of the webinar, and finally 3, review our webinar schedule and register for the upcoming webinars. And we have 2 great speakers lined up for you this evening. Dr. Deborah Miller is a member of the professional staff at the Mellon Center for Multiple Sclerosis Treatment and Research of Cleveland Clinic. She is a master's prepared clinical social worker, and her practice interests focus on marital and family adjustment to the consequences of MS, and she has lectured nationally on these subjects. Dr. Miller recently completed a study using the Internet to improve self-management of chronic illness, and she was also a member of the research team that developed and validated the Multiple Sclerosis Quality of Life Inventory. Janet DeClark is a speech pathologist in private practice in Edwards, Colorado. She has been in the field for almost 30 years and has worked with individuals with multiple sclerosis and other neurological diseases, as well as those with traumatic brain injury and stroke. Janet's emphasis is in home health, inpatient, outpatient, acute, and post-acute settings, with special emphasis in functional rehabilitation as part of a multidisciplinary team. So before we get started, we'd like to learn more about you. So let's do a quick survey to get a feel who's on the webinar with us. I just put a survey up, and it looks like it's overwhelmingly individuals living with MS, and we have some support partners, healthcare professionals. Fantastic. So with that, we'll move into this evening's webinar. And one additional quick polling question for you. We'd like to know if you have experienced cognitive issues. And let me get to that polling question. Are they mild, moderate, severe, or are you not experiencing any issues? Great. Thanks for taking the time to answer these. It helps us to get feedback on who's on the call. And with that, we'll move into Deb Miller's presentation. Thanks so much.
Could you give us just a little bit of feedback on how people rank themselves in terms of their cognitive impairment?
Sure. I think just asking with levels.
Okay, that's
if
fine.
It's mild or moderate. It looks like overwhelmingly it's moderate, with mild kind of coming in that second there.
I see.
And it looks like not too many with severe issues.
Great. Okay, well, thank you for that, Mel. This is Deborah Miller, and I'm pleased to be here with Janet this evening to talk with you about multiple sclerosis and cognition. And it's not surprising to see that most of you experience some level of cognitive concerns, hence your interest in this program. It's important to understand that the cognitive aspects of multiple sclerosis are as common as the physical components. In fact, we estimate that between 50 and 60% of people with multiple sclerosis experience some sort of cognitive changes over the course of the disease. As is demonstrated by your responses, for many people, the symptoms are mild to moderate, but can range to severe. We find that the cognitive difficulties associated with MS usually progress slowly over time. However, it's very important to pay attention to cognitive concerns even very early in the disease, because we know that cognitive symptoms are one of the major reasons that people with MS leave the workforce early. Cognition and fatigue are the issues that are more likely to prompt someone to quit working or to be forced to quit working than mobility issues. And that loss of employment, which is so important to so many people, to all of us, can really be avoided by actively identifying what kind of cognitive problems exist and by utilizing some of the management strategies that we'll talk about during the session tonight. Next. For some reason, the cognitive problems associated with MS have really only been talked about extensively over the last 15 years or so. Previously, people were described as having MS personalities, which really does not exist. But there was a focus on a personality type as opposed to cognitive changes. But in fact, a physician who discovered and named multiple sclerosis, Dr. Charcot, described the symptoms of the cognitive problems as early as 1877. So this has been a long understood aspect of the disease, and it makes a good bit of sense. MS is a disease of the brain and central nervous system. Thinking happens in the brain, and as lesions occur, thinking and its various components are affected as well. Next, please. So what I'll be talking about next are some common cognitive problems in multiple sclerosis. Next. Many people talk about the problems that they have with cognition and MS in terms of memory, that they have a hard time pulling things out of their memory bank. It's like they've got a computer that's overloaded with information and it's hard to pull it out accurately. But what we are understanding better as we have more detailed testing of cognition, that the difficulty actually lies more in terms of learning new information or being able to bring it into the memory bank. Oftentimes, the problem not only lies with acquiring this information, but a person can be distracted while they're learning something, and that difficulty with attention and information processing can impede a person from learning new information rather than remembering information that they've already obtained. We also know that speed and capacity of pulling out information can also be affected, so that it's possible to do things that you've always done previously, but just not as quickly. Next slide. So I love this slide, and I want to thank Janet for it. She aptly demonstrates how people who have some problems with concentration and the different forms of attention and concentration and executive functioning may have a hard time thinking through a series of how to stop a runaway horse and take a rather preemptive approach of just taking care of the problem, but ending up with no transportation after you've solved the problem. So some of the problems that can occur with cognition is difficulty with divided attention, multitasking. Most people today take pride in the fact that they're able to do several things at one time. We know that everyone, regardless of their MS status, is not as good at any given task if they're multitasking, but it's more difficult for individuals who do have MS. People also have difficulty shifting their attention away from one stimulus to another, so that if you're in a three-way conversation, it may be difficult to shift attention from one person who you're talking with to what the other person is responding. In a similar way, concentration, the ability to pay attention to what it is that you want to pay attention to instead of the sirens that are going on outside or the television set, can also be difficult. Executive functioning is usually one of the more significant difficulties that a person experiences with MS, and that involves the ability to plan, organize, think through, and decide the best way to get to a desired end. Next. In addition, a person's perceptual skills can be affected, and this has a lot to do with one's ability to get from point A to point B, whether that's in a building or while you're driving in a car, because you lose your sense of direction, and it's difficult to recognize the landmarks that you're used to seeing. And oftentimes people will describe themselves as driving and suddenly not knowing where they are. This is an indication of visual perceptual skills. People also, I think this is the most common and sometimes the most frustrating in daily conversation, difficulty is problems with verbal fluency or word retrieval. And these are probably associated with slowed processing speed. Problems with being distracted, or in this case, it really is a problem of being able to retrieve something that's in stored memory. However, if you're presented with an object and asked to name it, that is an issue that is rarely affected among people with MS. Next. But it's really important to know that managing cognitive problems that any of you face is best dealt with awareness of the problem as well as humor. Despite its name, thesaurus was quite often at loss for words. And this has been going on for a long time. And what we hope to do tonight is to offer you some strategies if you find yourself in this situation. Next. It's important to understand what functions are generally unaffected by multiple sclerosis. And it's also important, there were several questions that I read that you submitted in advance. The problems with cognition and MS are very, very different from those caused by Alzheimer's. The problems with memory in MS are usually very specific and discrete, whereas Alzheimer's presents in a general cognitive decline, so the compensatory strategies are not able to work. And unlike Alzheimer's disease, general intellect, remote memory, memories from your childhood and young adulthood, as well as being able to recognize people that you haven't seen in some time, conversational skills, and ability to read, as long as you're able to remain focused and concentrated on what you're reading. All of those functions typically remain intact. Next. It's also really important to discuss the connection and the distinction between cognition and depression. These are two very separate symptoms of MS, but oftentimes they occur in combination. It's important to be able to work with a healthcare professional to sort out what are cognitive problems and what are issues of depression. And it takes a healthcare professional to really sort this out because there are so many symptoms that overlap the problems that the way that a person experiences cognition problems and depression. Fatigue, lack of concentration, distractibility are symptoms that are common to both. The thing that is important to keep in mind is that depression is probably the most treatable symptom of MS that we have available to us. And so it's very important to work with healthcare experts who can help you sort out the distinction between depression and cognition so that you're adequately treating both of them. Next. This slide is like just overwhelming for me to look at. It's like you can't walk and chew gum at the same time. I imagine that there are people on the call who've experienced this sensation. It can have a huge impact on a person's ability to maintain a strong self-concept of what their usual abilities are. And there are many different reasons why you can't walk and chew gum at the same time with the cognitive problems of MS. We're talking about divided attention. We're talking about lots of distractions. We're talking about executive functioning as well, what to do next. So it's very important to recognize and that these feelings are totally natural in response to the symptoms that you're experiencing. But it's also really important to keep in mind that they're treatable and they need to be attended to. Now, I also want to mention that we talked about the fact that there's a certain proportion of people who have executive dysfunction and severe cognitive problems. And those individuals may not be aware of the fact that they have cognitive problems. Their family members will be concerned. Their healthcare providers will note that they may be having difficulty making decisions. And the person, him or herself, may not be aware of this. So this is a very minor component of people living with MS, but it's important to keep in mind that there are some people who have significant cognitive concerns and are not aware of them themselves. Typically, people are aware of the problems that they're having. Next slide. This slide also demonstrates that we need to think about the emotional consequences of cognitive problems. Cognitive problems can stress relationships. Oftentimes, forgotten or misinterpreted messages are taken as not caring or as just a lack of interest. And when you find this happening, it's really important that if you find yourself saying to your partner or to other people that are your colleagues or coworkers, we've talked about this already. Don't you remember that it's important to think that this is a time when you need to start exploring compensatory strategies. Next. This slide presents so many of the different symptoms that people experience with multiple sclerosis. It's both the visual spatial problem, difficulty with concentration, difficulty with remembering landmarks. It can be a very frightening experience both for you and for your partner when you find that you are not in a place where you know to get home from. And if that happens to you, it's really important for you to talk to your healthcare professional about that. Next. Cognitive problems can also have significant financial consequences and practical implications. And therefore, it's very important to be open to recognizing and discussing when these problems are occurring and what you're going to do to manage these difficulties. And that's what Jan is going to talk about soon. Next. It's also important to establish routines that Jan will talk about so that this doesn't happen to you. Mom, I told you yesterday that I was going to Sarah's house after school. You need to build strategies to build trust that even with the cognitive changes that you may experience, that the family is still going to be functioning. So finally, with the last slide, I have a call to action that you need to take a look at how cognitive dysfunction may be affecting your relationship and your self-worth. You have to make up your mind that it's okay to do things differently than you have in the past. While abilities don't typically improve in terms of memory function, we can enhance function through compensatory strategies. And with that, I'm happy to turn the session over to Janet DeClark, who's got some great recommendations for how to manage these difficulties.
Thanks so much, Deb. And you did a wonderful job of really explaining the major issues with MS and cognition and what some of the most common manifestations are of cognitive problems with MS. I'm going to be talking about the management of these cognitive problems. In other words, what do we do about some of the challenges we're having? And I'm glad Deb brought up the issue of compensatory strategies, because we're going to be talking about that. We're going to be talking about, I'll be mentioning remediation and compensation and what the difference is between those. So let me move on. And let's talk about, there we go. Oh, wrong one. There we go, remediation. Remediation is really something that occurs most often in therapy, in speech therapy, or when you're doing OT or with a neuropsychologist. And the idea of remediation is to restore those cognitive abilities that are impaired. So if there's some testing done and you find out that there's some specific abilities that are impaired, then you work on remediating those, usually with a professional. I refer to it as drilling the deficit, but it really is kind of tackling what those deficits are head on. But that is normally something that occurs in treatment, but sometimes people also do very specific brain training games and things like that on the computer. Computer-based memory programs, some of those are also used in treatment. There are also specific tasks like attention process training, tasks to make you much faster at what you're doing, or trying to memorize word lists of increasing length. I know there are a lot of applications out there that do things like this. And the advantage is that the tasks are very challenging, and stretching that mental muscle is a really good thing to do. The drawback to direct remediation of something very specific is that it can really retrain a very narrow skill set that doesn't necessarily carry over to everyday activities. And that needs to be done in many situations where you need to train a narrow skill set, but lots of times you really just want to improve your everyday functioning. So perhaps doing some of those very specific brain games on the computer may not serve you as well. Here's a kind of an example of what can happen. Brain training has done wonders for my memory. And, he may be very good at doing some of those games on the computer, but he's forgotten to put his pants on. So we are going to, with that in mind, move on to compensation, which is a little more encompassing. And compensation really focuses on function instead of the deficit. So it's really to concentrate on how things are going in your life instead of a specific deficit. So it can really hit on a lot of different cognitive issues. Just becoming more organized can really help with attention issues, can help with memory issues. It's not like you need to specifically target each one of those cognitive functions. So it is not necessary to remediate an ability in order to improve a function that's based on that ability. So really, compensatory approaches are the most useful ones in improving ADLs, which we say are activities of daily living. So we're going to talk about compensatory approaches when we're talking about managing these cognitive issues that we're talking about this evening. Okay, when it comes to using strategies, there are a couple caveats I like to think of in terms of using strategies. And first of all, that's just look at yourself and think, what kind of person are you? Do you like to write things down? Are you high tech? Do you like the smartphones? Do you like computers? That sort of thing. But also, many people say, I'm having memory problems. Try to think about how that problem manifests itself. Is it forgetting things in conversations? Is it forgetting appointments? Is it forgetting words? Try to think of it in more specific terms. How do those memory problems manifest themselves? Because how you address those with strategies, it really helps to know what is happening in your life. If you're forgetting words more often than anything else, then use some strategies that help you with word retrieval. And don't try to be something you're not. If you're not the type that is a high-tech person, don't try to become one. Using compensatory strategies really have to fit you and your personality. And so writing things down is just fine. And I can say that because that's something I still do myself. Another big suggestion is, and Deb did touch on this earlier, is letting go of the I've always done it this way sort of mentality. And that's a hard thing to let go of. We have patterns of doing things. It's been very automatic sometimes. But if those patterns are no longer effective, then letting go of the I've always done it this way sort of idea will really open up the door to better function and trying to figure out a different way to get to that same goal.
Hey, Janet, I'm sorry to interrupt for a second.
Yeah.
Are you by any chance on a speakerphone or
I'm not.
close to the phone? We were just getting a little fuzziness, and I was just trying to figure out what might be going on.
I could try to fool with on my phone, I could try to fool with, let me try the volume.
Maybe just
Is that any better?
Volume. It's just some fuzziness. You can still be heard. It's just fuzzy.
It's fuzzy. Uh-oh. Uh-oh. Yeah, I'm sorry about that.
That's okay. Sorry to interrupt. If you want to go ahead and continue, and I'll just try and figure out on this end.
Okay, thanks so much.
Thank you.
Another suggestion for using compensatory strategies is to be open to trial and error. And a big thing is if you're having issues that are really affecting your life and affecting your daily functioning and your safety and affecting your work, get professional help. Get an assessment, an evaluation, treatment from an occupational therapist, a speech-language pathologist, or a neuropsychologist. You really want to look at how these issues are affecting you. And if it's pretty significant, then you do want to get some professional intervention. Okay, when I think of strategies, I like to think of them in terms of internal strategies and external strategies. So we're going to start with internal strategies here. And internal strategies are ones that really don't require any sort of external aids. These are things you kind of carry around in your head, little tricks, as it were, that you can use to help you remember, to help you to process, and to help you attend. One thing to do is to combine modalities, and that is using all of your senses. So if you're listening to something, try to, if you can, read it as well, or hear it again, or write it down, or practice it. Think of using your 5 senses and combine all of your modalities and all of your senses to help you to process and help you to remember. Another one, which is one of my favorites, is the repeat and verify technique. And one of the reasons I like this is because it really works very well in conversations. And the people that are talking to you are usually very flattered when you do this. It involves listening to what somebody has to say, and I'll give you an example. We're planning dinner at 6 o'clock next Wednesday. And you repeat that by saying, oh, that's great. So dinner, 6 o'clock next Wednesday. That does a couple of things. That verifies that what you heard was correct. It allows you to say it and actually hear it again, so you've heard the information twice, and it buys you a little processing time. And it also shows that you're really listening to that person that's speaking to you. So it really does a lot of good things all at once, and most people don't know that you're doing it. It's just a conversational technique. And that works well in conversation. I think it also works well in the doctor's office and with pharmacists and information that you really need to remember. Another internal strategy is spaced rehearsal. And this is repeating an activity or information at gradually lengthening intervals. And what this does is it improves the storage in your brain. It improves learning of that information. So for example, you may be trying to recall a phone number or learn a phone number, and you say it to yourself after a few minutes, and then you wait, instead of 3 minutes, you wait 5 minutes, and you say it to yourself again, and you gradually increase that length of time in order to improve that storage. Another idea is to build associations. And I think a lot of people try to do this anyway, to remember things. And that's making visual or verbal associations between new information, familiar people, names, places, colors, anything you really want to try to learn and recall. And an example of this, a rather obvious one, is if you're trying to remember a name. A guy's name is Bird. He looks like a bird. You make that little visual association. Oh, yeah, he's the guy. It looks like he has a beak, and his last name's Bird. You're not going to forget his last name. That's a pretty obvious one. But to give you an example of another one is, and I'll give you a personal example, is I was parking at the airport, parked on the 4th level last week, and wanted to remember the door I was going in to the terminal. They have numbers on them. And the door was 413. And the way I remembered it was like 4, that's the level I'm on, and 1 and 3 add up to 4. And I remembered that in my head for a week because I made that association. There are no rules about how to do that. It's whatever works for you. Another very important part of using internal strategies is something called self-advocacy. And I think this is sometimes easier said than done, because what this involves is actually trying to modify your environment a little bit to make it easier for you to process, to make it easier for you to remember. And that involves things like, as examples here with attention, if you're having some trouble handling distractions, saying, could we have it quiet, please? Maybe we can move over here to a quieter corner and I can listen to what you're trying to tell me. If someone is asking you to do several things at one time, and as Deb suggested, multitasking is more difficult with cognitive problems, saying, I can handle only one thing at a time. So let me finish this first, and then I'll listen to what you have to say. And I consider that a process and not an event. Self-advocacy is that way because I think it's hard for people to admit sometimes that they're having a problem. And yet it does not shout, I'm having cognitive problems due to MS. But it is very difficult for all of us to say, I'm having a little trouble hearing you, I'm having trouble remembering this, I'm having trouble taking in what you're saying. And so doing this a little bit at a time is a good idea. It doesn't come all at once. Here are some ways to use those self-advocacy strategies for information processing, as well as learning and recall. And these things are very related to each other. One is asking people to repeat things, so you're hearing something twice. Asking for something to be said a little bit slower. Remember what Deb mentioned about information processing, and that speed can be affected. One thing at a time. Here's one that I hear a lot. I'm overloaded. I'm overwhelmed. And when you get that sort of feeling, it's time to take a break. I think we all reach those moments where we can't process anymore. MS or no MS, I think we all have experienced that. And just saying, I'm overwhelmed, I've had enough, I need to take a break. When it comes to learning and recall, that could show me, could you please demonstrate to me how this is done, verifying that you're doing something correctly, is this right? Practicing, writing things down. There's nothing wrong with doing that. Writing things down actually does help you to remember later on, helps you to retain. The last one, listen for me and tell me later, I find especially useful for very important things like appointments, taking somebody into a doctor's office with you. Could you please come with me and listen for me, and then we can discuss what the doctor said. Here's what I heard him or her say, and your partner can say, well, this is what I heard. And so that's also a very useful strategy if you're able to manage that. So moving from internal strategies to external strategies. And this is, external strategies involve the use of external aids. This is our day runners, calendars, Google Calendar on the computer, our smartphones, all of those things. So there are a few things to remember about using external aids. And a very important one is to consolidate and centralize your aids. Choose a room in your home. It may be the home office where the computer is. It may be your kitchen where the big family calendar is. But choose a spot where everything, all the information for everybody in that family is going to go in that place. And an example would be put up a calendar large enough to keep track of everybody's appointments, not just your own, but if you live with others in the home, everybody else that's living in that home with you. What are they doing? When are their Little League practices? When are their school conferences? When are their dinner reservations? And all of it goes on one large calendar. The same thing can happen if you don't want to do the large writing calendar in the kitchen. Google Calendar, Outlook on the computer, as long as everybody knows that that's where all the information goes. It's only in one place. So that's kind of the high-tech version of the same thing. And then choose a spot where, like a basket, mail, bills, phone messages, keys, your wallet, they all go in that spot. You don't have to become Martha Stewart and organize everything very perfectly. Sometimes it can just be a basket where you know where to look. If you can't find your keys, you know that's the first place to look. And so centralize where you keep things and where you keep information. Okay, and the other thing is what do you do? Obviously, you can't carry your computer with you in the car. You cannot carry a big, huge family calendar with you around. So another external aid to use is the on-the-go version of the same thing. So take a small notebook or a day planner. That's like the day runners or the Franklin planners that we're familiar with. And log all appointments and everything from that home calendar into that day runner. And you carry that with you. And it could be every evening. You look at that and you put the next day's activities on there from the main home calendar, and then you carry it with you. The same thing can happen with a PDA or a smartphone if you are so inclined to use something like that, because iPhones and most smartphones now have the capacity to have calendars and reminders and keep track of tasks and appointments. You just want to make sure that whatever you're carrying with you mirrors the main calendar and organizer you have at home. Another good aid, especially if you have some issues with keyboarding or using the little letters on a smartphone or writing, is using a digital voice recorder. And I used an example here of an Olympus VN 6200. There are many kinds. You can find them at Walmart, Radio Shack. And you can actually speak into those and record to-do lists, record entire lectures, and record things you want to remember. And a lot of times you can transfer that to a computer. But it's interesting because now most smartphones have this capability, usually the little reminder tab. And you can do that on your smartphone as well. But whatever you do, keep that little to-go planner with you at all times and regularly transfer that information back and forth. So the whole point here is to have a main calendar and a main organizational section at home and then a little to-go version with you that travels with you throughout the day. The point is keep the system simple. I cannot emphasize that enough. You want to limit your aids to one at home and one on the go. I usually say to people, limit it to 3, perhaps allowing for something else like a digital voice recorder or something else. But keep it very simple, because the more aids you have, if you go beyond 2 or 3, you will actually become more confused and less organized. And it will make you function worse than you were before. So there's kind of that critical point where it becomes too difficult to manage all of them. So keep it very simple and keep your aids at a minimum to 2 or 3. If all of that information is scattered everywhere, just think of that's what your brain is doing. And I bring up sticky notes or Post-its, as people call them, because people ask me about them on a regular basis. And I always say use them sparingly. They're really great to have if they go on your main calendar or if they go in your day runner. That's fine. But if you have one on your bathroom mirror, one on your refrigerator, one on the dashboard of your car, you're going to get very scattered and it's going to become too confusing. So you really want to use those sparingly. And if you do have to use a sticky note and stick it in your planner or on your smartphone to remember something later on, that's great. If you use them too much, here's what can happen. You really don't improve your memory, or you forget where you put the sticky note to remind you to get something you need to remember. And that's what can happen if they go everywhere. So remember to use those sparingly. Some other strategies that are very helpful, we tend to put down technology and email and text messages, and I know we tend to think of teenage kids texting all the time, but there is a definite upside to these things. And it's that emails and text messages actually offer written records of conversations and information. So one way to use this is to say, gosh, you want to give me directions to your house. Would you mind emailing me that information? That way you have a written record of what it is. Or even, would you mind texting me that information? Could you text me that phone number you're giving me? And then, you may remember it when the person's telling it to you, but at the very least you also have something else to refer to if you don't recall it later on. And then you can look on your phone, look at the text message, and see what it is. Voicemail and answering machines are also excellent. Those are also records that you can listen to something again over and over and over again. And you can save important information that way, and then you can replay that information. I use the example of, if somebody's calling to remind you of an appointment, you may want to save that and then play it again, and then you can play it again. You can write it down on your calendar. But all of those, that technology is a good thing because it gives you a backup. Some other good strategies, some other good aids are timers and alarms and beeping watches. Now, again, most smartphones have this function as well. But one thing I hear people complain a lot about is prospective memory, and that's remembering to remember something in the future. Remembering to remember that you have 6 o'clock dinner reservations next Tuesday. So a beeping timer or a watch, something, if you input that, can go off and remind you around the time that that event is supposed to occur. And, a day planner, you can also do the same thing. You want to use a type of day planner that has a zippered section in it and has one page for every day. So you have plenty of room to write. And you can also throw things in there and zip it closed. So then you know where to look, and business cards, even sticky notes you put in there, you can be reminded of later and then input those when you have a chance into your day runner. Other specific function aids are medication reminders. A lot of those have beepers. Color coding. Mondays are red, Tuesdays are green. That also really helps. Someone did mention here, I noticed that GPS, route finding, if you're having visual perceptual issues, GPSs are really great. You just do want to make sure that you don't have the kind that drives you off a cliff, that it is updated. But sometimes a camera and taking pictures of routes, and so you are remembering landmarks, also helps you with route finding. Keeping written instructions posted on a device or in an appliance, putting them on the side, taping them on the side, so you remember how to work those. Those are all some good strategies to use for very specific sorts of things. Some external strategies for word retrieval. A thesaurus is great. That isn't something you can always use when you're talking to somebody in conversation. So when you are trying to struggle for a word in conversation, one thing I recommend is talk around that word. Much like the little cartoon that Deb showed, is talk around the word you're trying to think of. If you're trying to think of the word locomotive and you can't come up with it, say, it's that thing, that part of the train that's on the front. And very often the person you're speaking to will say locomotive, or they'll say, oh yeah, I can't remember what it is, but I know what you're talking about. The whole point is to keep the conversation going. And but a thesaurus is also a really good thing if you're writing things. Thesaurus.com is a great way to just find another word that means the same thing. Also using speech recognition software. Some of you may be familiar with this. For those of you that have trouble with keyboarding and, it's voice recognition, speech recognition, and you speak into your computer or even your smartphone, and it will then print out exactly what you're saying in words. So those are some internal and external strategies, some very general ones. I'm looking forward to taking some of your questions. I know we could only touch on some of these, and I'm sure you have a lot of questions, but just keep in mind that using aids, internal and external strategies, can actually help you get around a host of your cognitive issues. And choose one or two and try them out tomorrow and see how they work. Okay, Mel, thanks so much. I'm going to the next slide.
Yeah, and I see here you have a couple of slides. It looks like books that you're referring.
Some recommended reading, yes.
Always a good thing. I did have someone ask about that, and then also the recommended websites. And just so everyone knows, we will also be sending you a copy of the slides after the presentation. So you will get copies of all of these slides. We like to share those with you. And before we move into the Q&A session, we have one final polling question for you. If you have cognitive challenges, what are your cognitive challenges? And I'll put this up on the screen here so we can kind of see what these answers are. Seems like, give it a second here to settle down. It looks like word retrieval is a big issue, and then also attention and memory. And again, we really do appreciate you all taking the time to answer these, because it gives us some great feedback as well. Is there anything that you all want to add to this, or we'll just move into the question session?
The only thing that I would add, and this is Deborah, is that don't be embarrassed or afraid or reluctant to discuss the memory problems you're having with your healthcare providers. People feel that, you know, this is just part of normal aging. They write it off to all sorts of being overburdened with lots of other things. But if you find that you're having memory problems and that they're interfering with your daily functioning, there are ways to determine what is normal aging, what is related to MS cognition, what might be related to medications you're taking, or if there's some other kind of condition that's emerging as well. So when you experience these problems, take them seriously and ask your health professional to help you address them.
Great. Thank you so much. We appreciate that feedback as well. With that, we'll move into the Q&A session. Oops, there we go. Slide deck acting up on me. So we'll start here with the questions. I had a few people ask about vitamins or herbs that could potentially help with cognitive issues.
This is Deb, and I think that it's really important to understand how essential it is to have good research behind any of these different kinds of strategies. And unfortunately, we do not have evidence of any vitamins or supplements that can enhance the cognitive problems associated with MS. So that if a person finds something that they believe helps them and it's not breaking their bank, and they're upfront with their physician about the fact that they're using it, that is reasonable, but we don't have any evidence to support the use of those types of supplements for managing cognitive problems.
Certainly. And is there anything that you'd like to add, Janet, or we can just go to the next question?
No, I would echo the same thing.
Okay. Another question that I have here is, are there strategies to help with not just mixing up words, but saying syllables in the wrong order? I know we talked about word retrieval, but what if it's just coming out with syllables in the wrong order?
Okay, if we're talking about syllables in the wrong order, this is Janet, by the way, that's actually a motor timing issue where there's a little bit of a breakdown between the brain and the muscles of the mouth and the sequencing of how you put together words. And normally it's more evident the longer a word is. The more syllables there are, the harder it becomes. And that is different from word retrieval. And, you know, one thing is if it is something that's happening regularly that's really preventing you from communicating, getting a speech evaluation would be a really good idea. But if it is something that is happening occasionally and you're getting tripped up, first of all, you want to look at, are you fatigued? Are you stressed? Is it a period where you're really not at your best and it's more likely to happen? And then the way you get through it really is slowing down your rate and trying to think of a word in terms of syllables instead of as a long word. The word explosion, explosion. That's really all words are, is just a bunch of syllables. And thinking, okay, I'm going to say this syllable, and then this syllable, and just slowing down that rate, and sometimes tapping your finger to get through a difficult word is a good idea.
And this is Deb, and the only thing that I have to add to that is that's why it's really important to have an interdisciplinary team on your side, because I could not have begun to answer that question.
Well,
let's see here. Here's a good one. Should all patients with MS have cognitive baseline studies done, newly diagnosed with MS?
You take that one, Deb.
I think that someone who's a neuropsychologist or a speech pathologist may encourage that. And I think that for people who are really interested in planning ahead and wanting to monitor what's happening with their MS, that this is a very important aspect to monitor, and having baseline cognitive testing can be as useful as an MRI. It's really important, though, to work with somebody who's up to date on the state of the art, because it's essential that you get somebody who is really knowledgeable about the cognitive aspects of MS to do the assessment, who know how to do the billing, because it can be very expensive and out of pocket if not properly billed. And increasingly, there's consensus that the typical 4 to 6 hour battery is not necessary, that there are shorter, more efficient, but just as informative batteries for testing that can be used, especially for baseline assessment. So be an informed shopper when you go looking for a baseline assessment.
Wow, and Deb, I didn't even think of that as far as the cost and the billing and the coding. That is great information.
Here's another question that I have, and this is regarding young kids and teenagers with MS and understanding the importance of honoring the request when they're having cognitive issues, maybe suggestions or examples on how they can speak up and be an advocate for themselves.
Well, I'll take that from a different perspective. With children and teens that have MS, having done a little work myself actually in the public school system and IEPs and all of that, chances are if there are some issues, then that will be something that is apparent in the school system or something that you want to bring up. So it's addressed during the daily school day. And I can just say from my experience, one of the things that has usually been stressed as significant goals for young teens and teenagers is self-advocacy, whether it's MS or another disability they may have, and learning how to speak up for themselves and request what they need from the world. And so I think that is something that's very important to teach them, but I would also really enlist all of the resources that you may have at your disposal and the school system to do that.
Certainly, and on the other side of that, if someone is a parent or a teacher, and for example, a teacher with a child in the class that has the cognitive issues, what suggestions would you have for that individual?
If that is a child that has an individual educational plan or a 504 or whatever it is, really following through and contributing to what that goal setting is, and speaking up about the issues you're seeing with this particular student or child. I think with children and with teenagers we focus, rightly so, very heavily on academics. But at the same time, cognition can go beyond that. And cognition also has to do with how somebody is getting through their day, and can they catch the bus and read a bus schedule. And speaking up for that sort of thing and making sure that that is also part of a plan and something that you're addressing, how a child is learning, not just what they're learning.
Great, thank you. And I'm going to try and fit in a few more questions. I know we started a few minutes late, so we're just running over slightly, but some great questions here. One individual asked, how do I know that I am depressed?
This is Deb. Oftentimes a person becomes so demoralized and so low energy that it can be difficult to diagnose your own depression. But typically, the symptoms that we associate with depression are difficulty with sleep, difficulty with concentration. If you've gone for more than 72 hours without really feeling good about yourself or happy about something that's happened, it's an important concern to raise with your healthcare professional. If you're tearful on a routine basis, that's certainly an indication of depression. And I think that most everyone with MS should be aware of the likelihood of depression. The prevalence is twice as common in MS as the rest of the population. We think that it's a combination of the way that MS affects the brain that can cause basic biologic changes, and certainly there are reactive aspects of how you feel about what's happening to you because of the MS that can cause depression. Anyone who questions whether they may be depressed or not should consult with a healthcare professional to sort out what's going on. And I can't emphasize enough that depression is probably one of the most treatable symptoms of MS. It's one that's well understood and appreciated by most healthcare providers. And if your healthcare provider brushes you off about concerns with depression, you need to be seeking a second opinion. So I would say that there are both physical and psychological symptoms. If you're concerned about yourself, you need to raise it with your healthcare provider.
Great. Wonderful. Thank you so much for fielding that one. Here is a question. It's called Luminosity. I'm not quite sure if I'm saying that correctly, but it is a program or website on the Internet where you can improve memory and so forth. Do you have feedback on programs such as that, or even, for example, games, simple word games in Yahoo or MSN? Can those help with improving memory and other functions?
You know, I'm going to turn this right over to Jan, but I looked at Luminosity, and it looks like it's very interesting. I think it's for subscription, and you need to be cognizant of costs at all points. But I think it develops very specific skill sets that are not generalizable. And that's my concern with Luminosity in particular. I had not heard the name before, but saw it come up on the question list and took a look at it. And Janet, I'll turn it over to you.
Well, I'll follow on that, Deb. Thanks so much for bringing that up. And I actually have looked at Luminosity, and I've gone through it a bit. I have had some patients that have used it. The rule I always go by is if it's something that's fun, then do it. If you find it challenging and fun, then do it. Again, there are cautions about training in narrow skill set, and luminosity does really kind of pinpoint very narrow skill sets. And so you really want to be aware of whether or not those skills of counting the number of bubbles going up on the computer screen, what will they generalize to in your life, aside from getting very good at counting bubbles quickly. So you want to be very aware of that. And yet at the same time, games and things you enjoy, if you enjoy them, do them, because then they are stimulating. Crossword puzzles are great. One of the things that has been found is that games that really tap into a lot of different cognitive areas at once, so they're all integrated, are really pretty good. And there was a study, and I wish I could remember who it was done by right now, that a video game that was, it wasn't a video, it was a computer game called Rise of Nations, where you actually build a nation and you're building houses and all of that. That was actually a really good thing because there were so many things you had to do. It involved a lot of executive functioning and a lot of memory. But then again, what I usually tell people is play the piano. If you like to play the piano, then do it. Do something you enjoy. If something is challenging, then that is going to be good for you. If you like to play Jeopardy, do it. That'll be good for you. Just beware of getting into those brain training games that have very, very narrow focus.
Great. Thank you so much. Just maybe one or two more. This is a question asking how to be objective or recognize your symptoms when you're the individual with the cognitive changes.
Deb, you did kind of address that. You want to elaborate?
Well, I think that just as a lot of the strategies that Janet described involve others helping you, I think it's really important to let the people who love and care about you be open to their expressions of noticing these symptoms. A lot of times people will not notice the difficulty themselves right away. Their family members will be the first person to notice. I think it's really important to have open communication with the people who are closest to you about their perception of how your MS is progressing, particularly in terms of cognition, and to not being defensive about these problems. They exist, they're there, they're part of life. A lot of times the people who are most attuned to cognitive changes that they're experiencing are typically depressed and experiencing the cognitive changes because of depression. So I would again emphasize that having a depression for assessment, an assessment for depression, talk about switching your words around, is really important. If you do notice difficulties, yourself, use some of these strategies. I mean, Janet has described a wide range of strategies that truly can be beneficial to people with or without MS cognitive problems. And there were a number of questions that I saw in the pre-questions of how do you separate between what's normal aging and what's MS. And the take-home message there is that a person with MS is generally well into their 80s more likely to have cognitive problems than the general healthy population. So be open to the fact that this is a symptom just like bladder or walking difficulties or possibly hand tremor, and that you don't have the answer to managing those symptoms on your own, and it's really important to work with people who can help you manage the cognitive symptoms as well as the physical ones. I feel like I'm preaching, but
no, thank you for fielding that one as well. It looks like we are out of time, and I just wanted to say thank you to Dr. Deborah Miller and also to Janet DeClark for their insight this evening. And this is a great presentation. Thank you so much.
Well, Mel, I just want to thank the Can Do organization for making this available to your participants. I think this is a real service that your organization does.
I second that.
Thank you.
It is very helpful. It can reach a lot of people.
Oh, sure. And I'm going to move into, we have our next webinar. It's on August the 14th, and it'll be at the same time, 8 p.m. Eastern Time. And it's going to be a special webinar on emerging therapies. We do this every year, and Dr. Randall Shapiro, a neurologist, is going to be the presenter. So please join us live from your home or your office at no charge for an in-depth discussion on topics relating to exercise, nutrition, communication, symptom management, and total health. Our unique webinar series provides insight from more than one MS expert so you can gain additional knowledge relating to MS. Interact with our team of Can Do MS consultants, ask questions, and learn how to adopt healthy lifestyle behaviors, actively co-manage your MS, and live your best life. And again, you can register for this and other webinars at www.mscando.org. And for those participating live tonight, as soon as the presentation is over, you'll see a survey appear on your computer screen. If you can just take a moment to complete the survey and help us continue to improve our webinars, that'd be great. We value everyone's feedback and input. And you will also receive a copy of tonight's webinar slides by email. That will follow either shortly this evening or early tomorrow morning. So again, thank you everyone for joining us.